Nurses, overworked and fatigued, cause significant decrease in their alertness and concentration, which may lead to medication errors. It's essential for the nurse to check the patient's identification using two identifiers, including the patient's name and birthday and their account number according to the agency's policies, and before administering any medication or starting any procedure. Various chemicals used in healthcare facilities contribute to safety issues. Material Safety Data Sheets, or MSDS, are required resources available in any healthcare agency, and any incidences of misuse must be reported. Other errors that must be reported include medication errors, bed sores in advanced stages, failure to diagnose or treat, and serious hospital-acquired infections. The Centers for Medicare and Medicaid Services, CMS, named Select Serious Reportable Events, SREs, as never events, those adverse events that should never occur in a healthcare setting. The CMS now denies hospitals higher payments for hospital-acquired conditions resulting from complicated by the occurrence of certain never events. Nurse-sensitive events indicate that nurses can directly impact their development, and such as fall or stage 3 pressure ulcers. Other CMS never events include surgical site infection, catheter-associated infection, air embolus, and foreign body retained after surgery. The National Quality Forum, a nonprofit organization focused on safety and quality, further defines serious reportable events, including surgery on the wrong body part, the wrong patient, retained foreign body, or intraoperative or immediately postoperative deaths. Injury or death related to the use or malfunction of devices in the hospital, patient suicide while under the care of healthcare facilities, death or disability related to medication errors, hemolytic reaction, death related to hypoglycemia, any incidents of stage 3 or stage 4 pressure ulcers, death or disability related to electric shock, burns, falls, or restraints, or care provided by someone impersonating a healthcare professional, patient abduction, or any sexual or physical assault on hospital grounds. Safety in the acute care setting includes assessing the patient's need or a risk for poisoning and electrical injury. Much of the equipment is used in the healthcare setting is electrical and needs to be well maintained. The nurse should remove equipment that's not working, order new equipment if it sparks when plugged in, and notify appropriate hospital staff. Radiation is a health hazard for medical professionals and used in the diagnosis and treatment of patients. If a disaster occurs while nurses are working in the hospital setting, they need to be prepared to respond and care for a sudden influx of patients. The Joint Commission requires hospitals to have an emergency management plan that addresses and identifies possibilities of emergency situations and their probable impact, while maintaining adequate supplies and a formal response plan that includes action to be taken by the staff. Smoking-related fires poses a significant risk as related to unauthorized smoking in a patient's bedroom or bathroom in healthcare agencies. The best intervention is prevention. The acronym RACE explains priorities during a fire, which includes rescue, alarm, contain, and extinguish. The correct use of a fire extinguisher is abbreviated in the acronym PASS, which is pull, aim, squeeze, and sweep. correct use of a fire extinguisher is shown here. Pull, aim, squeeze, and sweep the base of the fire. Evaluation allows the nurse to measure whether the patient has met their goals or outcomes. At this point, the nurse can revise, change, or dismiss any interventions. The nurse continually evaluates the patient's safety risk and updates the nursing care plan as appropriate. Patient expected outcomes include a safe physical environment, patients who are free from injury, and a patient who is knowledgeable about safety factors and precautions. A safe environment is essential for promoting and maintaining and restoring an individual's health.